All right, let's dive into male reproductive health, specifically some conditions that you'll probably see in your nursing careers.
Okay, sounds good.
So we've got a ton of sources here, studies, clinical guidelines, even some stories from experienced nurses. And the goal today is to help prepare you to care for men with these issues. We'll be talking about pathophysiology, the signs and symptoms, and of course, nursing interventions and treatments, including medications.
Sounds like a good plan.
We're going to cover a lot. Benign prostatic hyperplasia, prostate cancer, prostatitis, that's like the prostate trio, I guess. Then we'll move on to problems of the penis and scrotum, testicular cancer, vasectomy, erectile dysfunction, hypogonadism, and infertility.
Wow, that's a lot to cover.
It is. But
Yeah.
knowing this stuff is really important for providing good patient care.
Absolutely.
Now, before we jump in, did you know that prostate cancer is the most common cancer in men in the U.S., excluding skin cancer?
I did.
And for men between 15 and 44, testicular cancer is the most common.
Oh, wow, I didn't know that.
That's right. So while those might be the most well-known, all the conditions we're talking about today can have a big impact on a man's quality of life.
For sure.
Okay, let's start with BPH, benign prostatic hyperplasia. What exactly is going on when a man has BPH?
Well, with BPH, the prostate gland gets bigger because the number of prostate cells increases.
What causes that to happen?
It's usually linked to hormone changes that happen as men age, but the exact trigger isn't really clear yet.
So it's not cancer.
Nope, not cancer.
Mm-hmm.
But it can cause a bunch of problems.
Like what?
Well, that enlarged prostate can squeeze the urethra, and that's what leads to the most common BPH symptoms, like a weak urine stream, difficulty starting and stopping, needing to pee more often, especially at night.
So lots of sleepless nights.
Yeah, it can be.
Now, some of those symptoms also happen with prostate cancer, right?
That's right, they do overlap, so making sure you assess your patient carefully is super important.
Okay, nursing students, time for a pop quiz. You have a patient with urinary issues. What are some of the first questions you would ask them to figure out if it might be BPH?
Well, I'd want to know when the symptoms started and how long they've been happening.
Okay, what else?
How bad the symptoms are and if there are any other symptoms, like pain or blood in the urine.
Excellent. What about family history?
Oh, right. Don't forget to ask about family history and lifestyle factors.
Okay, perfect. So let's say it's BPH. What are our treatment options?
For mild cases, we usually just watch and wait. Basically, see if the symptoms get worse.
So you don't always need medication or surgery right away.
Not always. But if the symptoms are bothering the patient, then we can look at other options.
Okay, what are the main medications for BPH?
There are two main types. 5-reductase inhibitors, such as finasteride and dutasteride, and adrenergic blockers like tamsulosin and terazosin.
Whoa, those are some long names.
They are.
Can you simplify it for us?
Okay, so 5-reductase inhibitors, they actually shrink the prostate.
Oh, interesting.
Yeah, so less pressure on the urethra.
So what about the adrenergic blockers?
Those basically relax the muscles in the prostate and bladder neck, and that makes it easier to pee.
So it's like a two-pronged approach. Shrink the prostate
Yeah.
or relax the muscles around it.
Exactly.
But sometimes medication isn't enough, right?
Yeah, you're right. If the medications don't work or the BPH is severe, we might have to consider some minimally invasive therapies, like using lasers, radio waves, or microwaves.
Wow, those sound pretty high-tech.
They are. And they're becoming more and more popular because they can get rid of that extra prostate tissue without a big surgery.
So less invasive.
Yeah.
But sometimes you still need surgery, right?
Yeah, sometimes. The gold standard surgery is called TUR-RRP, transurethral resection of the prostate.
That one sounds a lot more invasive.
It is more invasive. They insert an instrument through the urethra to remove part of the prostate. It works really well, but it does come with risks and a longer recovery time.
Okay, nursing students, here's where your skills are super important. What are the key things to focus on after a patient has a TURP?
The biggest things are preventing complications like bleeding and infection. We also want to help them get their urinary control back and talk to them about any concerns they might have about sexual function.
What about pain management and getting them ready to go home?
Yeah, of course. We need to make sure their pain is managed and teach them how to care for their catheter, manage their urinary control, and know what signs of infection to watch out for.
Sounds like nurses are involved in the whole process, from before the surgery all the way through recovery.
We are.
Okay, let's move on to a more serious topic. Prostate cancer. It's kind of similar to BPH, but it's obviously a lot more serious.
Definitely.
What causes prostate cancer? What's happening at the cellular level?
Prostate cancer is what we call an androgen-dependent carcinoma. That means it needs male hormones to grow, specifically testosterone.
So it's like the cancer cells are using testosterone to grow.
Exactly.
And the scary thing is, early prostate cancer doesn't usually have any symptoms, right?
That's right, it doesn't.
So how do we catch it early?
That's where screening comes in. The PSA test, which measures prostate-specific antigen levels in the blood, is really important.
But a high PSA doesn't automatically mean cancer, does it?
No, it doesn't. It can be high for other reasons too, like BPH or prostatitis, but it does mean we need to investigate further, usually with a digital rectal exam and maybe a biopsy.
Okay, so let's say we know it's prostate cancer. What are the treatment options?
Just like with BPH, it depends on a few things: how advanced the cancer is, how aggressive it is, the patient's overall health, and what they prefer.
So it's a personalized approach.
Exactly. For slow-growing cancers, we might consider active surveillance, which is basically watchful waiting.
So you don't always jump into surgery or other treatments right away.
Nope. But for more aggressive cancers, we have other options:
Like what?
surgery, radiation therapy, and hormone therapy.
Okay, let's break those down. What does the surgery involve?
The most common surgery is called radical prostatectomy. That's where we remove the whole prostate gland. There are a few different ways to do it: open surgery, laparoscopic surgery, and even robotic surgery.
Robotic surgery. Sounds pretty futuristic.
It is. It's becoming more common because it's more precise and patients usually recover faster.
Got it. What about radiation therapy?
So radiation therapy uses high-energy rays to kill cancer cells. There are two main types: external beam radiation, which is given from outside the body, and brachytherapy, which is where radioactive seeds are implanted directly into the prostate.
Okay, and finally, hormone therapy. We talked about that a little with BPH, but I'm guessing it's different with prostate cancer.
You're right. With prostate cancer, the goal of hormone therapy is to keep the cancer cells from getting the testosterone they need to grow. We can do that with medications that either block testosterone production or prevent testosterone from attaching to the cancer cells.
So you're essentially cutting off their fuel supply.
Exactly.
Now, I'm guessing all these treatments can have side effects.
Yeah, there are potential side effects with all of them. Some of the most common ones are urinary incontinence, erectile dysfunction, and bowel problems. It's important to be upfront with patients about these risks and support them throughout their treatment.
For sure. Okay, let's switch gears and talk about prostatitis.
Okay.
What is prostatitis?
Well, prostatitis is a little more complicated than BPH or prostate cancer. It's actually a group of inflammatory and non-inflammatory conditions that affect the prostate gland.
So it's like an umbrella term for a bunch of different things.
Exactly. There are four main types: acute bacterial prostatitis, chronic bacterial prostatitis, chronic prostatitis chronic pelvic pain syndrome, and asymptomatic inflammatory prostatitis.
Okay, that's a lot. Let's just focus on the most common types. Acute and chronic bacterial prostatitis.
Sure.
What causes those?
Well, as the name suggests, they're caused by bacteria that get into the prostate.
So antibiotics are the usual treatment then?
Yep, we use antibiotics to get rid of the infection.
Okay, that makes sense. What about the other two types? The ones that aren't caused by bacteria?
Those can be tougher to treat. Chronic prostatitis pelvic pain syndrome is the most common, but we don't actually know what causes it.
So no easy answers there.
Not really. The pain can be ongoing and really affect the patient's life, and antibiotics usually don't help.
So how do you help those patients?
We focus on managing their pain and improving their quality of life. We might use pain relievers, muscle relaxants, or even antidepressants.
So it takes a team approach.
Often, yes. Now, asymptomatic inflammatory prostatitis, that one usually doesn't cause any symptoms.
Oh, interesting.
Yeah, it's usually found when they're being tested for something else, and usually it doesn't need to be treated.
Okay, let's move on to problems of the penis. We'll start with phimosis and paraphymosis. Those sound a little scary.
They can be, but it's important to understand them. So phimosis is when the foreskin is too tight and can't be pulled back easily.
And what causes that?
It's usually because of inflammation, which is often related to hygiene.
So good hygiene is important.
Very important. Paraphymosis is more serious. That's when the foreskin gets stuck in a pulled back position and can't be moved forward to cover the head of the penis.
Ouch, that sounds painful and dangerous.
It is. It's a urologic emergency because it can cut off blood flow to the penis.
So what do you do?
The goal is to get that foreskin back into its normal position as fast as possible. Sometimes we can do it manually. Sometimes we need medication to reduce swelling. And in really bad cases, we might need to do a circumcision or a dorsal slit.
Yikes. So time is really important here.
Absolutely. The sooner it's treated, the better the outcome.
Okay, now for another urologic emergency. Priapism. What is that, and why is it such a big deal?
So priapism is a painful erection that lasts for more than 4 hours, and it's not related to sexual stimulation.
Oh, wow.
Yeah, and it needs to be treated quickly because if it's not, it can damage the erectile tissue and lead to permanent erectile dysfunction.
I bet that's not an emergency most men are happy about.
Nope. We don't always know the exact cause, but it can be caused by certain medications, blood disorders, or spinal cord injuries.
Okay, what do you do if a patient comes in with priapism?
It depends on what's causing it and how long it's been going on. We might drain blood from the penis with a needle, give them medication to constrict the blood vessels, or even do surgery.
Sounds like a tricky situation.
It can be. The faster we can treat it, the better the chances of preserving erectile function.
All right, let's talk about some conditions that affect the scrotum and testicles, starting with epididymitis.
Okay.
What is epididymitis and what causes it?
Epididymitis is an inflammation of the epididymis.
And that is?
It's that coiled tube on the back of each testicle that stores and transports sperm.
Got it.
It's usually caused by an infection, either a sexually transmitted infection or one that travels up from the urinary tract.
So like chlamydia or gonorrhea?
Yep, those are common ones. Or even E. coli from the urinary tract.
Okay, so if it's bacterial, you treat it with antibiotics.
Right. That's right. And if it's a sexually transmitted infection, both partners need to be treated.
To prevent reinfection.
Exactly.
So how do you manage the pain while the antibiotics are working? I'm guessing it can be pretty uncomfortable.
It can be very painful. So we try to make the patient as comfortable as possible. We recommend things like scrotal elevation, ice packs, and pain relievers.
Okay, so supportive care.
Yep.
Now, sometimes epididymitis happens along with orchitis.
That's right.
And that is
Orchitis is an inflammation of the testicle itself.
double the trouble.
Exactly. The causes are similar to epididymitis, infections or trauma.
And the treatment too.
Pretty much the same.
Yeah.
Antibiotics, pain meds, and rest.
Okay, let's move on to a couple of conditions that involve fluid buildup. Hydrocele and spermatocele.
Okay.
Let's start with hydrocele. What causes it?
A hydrocele is a buildup of fluid around a testicle, which causes swelling in the scrotum. It's usually caused by an imbalance in the production and absorption of fluid that normally surrounds the testicle.
Is it always there from birth, or can it develop later?
Sometimes it's present at birth. Other times it develops later, maybe because of inflammation or injury.
So do you always have to treat it?
Not always. If it's small and not causing any problems, we might just monitor it. But if it's large or causing discomfort, we might drain the fluid surgically.
Makes sense. Now, what about spermatocele? How's that different?
A spermatocele is also a fluid-filled cyst, but it's in the epididymis and contains sperm.
Oh, interesting. How do you treat that?
It depends. If it's not causing problems, we usually just watch it. But if it's large or uncomfortable, we can remove it surgically.
Got it. Now let's talk about varicocele. I've heard that can affect fertility.
Yeah, that's right. A varicocele is basically a varicose vein in the scrotum.
In the scrotum.
Yeah, it affects the veins that drain the testicles.
And how does that affect fertility?
Well, the thinking is that the extra blood flow and heat from the varicocele can damage sperm,
Leading to.
lower sperm counts, and less motility, which means the sperm don't swim as well.
So if a varicocele is causing problems, what are the treatment options?
There are a couple of options. One is surgery to tie off the affected veins. The other is sclerotherapy, which is less invasive. It involves injecting a solution into the vein to block it off, so the blood has to flow through other healthier veins.
Okay, so a couple of different approaches.
Okay.
Now let's talk about a couple of conditions that need immediate attention.
Right.
First up, testicular torsion. What is it and why is it an emergency?
So testicular torsion happens when the spermatic cord, which carries blood to the testicle, gets twisted.
Oh, wow.
Yeah, and that cuts off the blood supply to the testicle.
And that's bad because
Because the testicle needs that blood flow to survive, it's a real race against time.
what are the signs and symptoms?
The main symptom is sudden, severe pain in the scrotum.
Ouch.
Yeah, and it can also cause swelling, nausea, and vomiting.
So if a patient comes in with these symptoms, what do you do?
We need to act fast. We'll do a physical exam and maybe an ultrasound to confirm the diagnosis. And then we need to get them into surgery as soon as possible to untwist the cord and restore blood flow. If we don't do it quickly, the testicle could be permanently damaged.
Okay, nursing students, this is when you need to be ready for. You need to recognize the symptoms quickly and make sure the patient gets the treatment they need right away. Every minute counts.
You got it.
All right, let's talk about testicular cancer. We mentioned earlier that it's the most common cancer in young men.
Yeah, it usually develops in the germ cells, which are the cells that produce sperm.
Are there any risk factors?
Yeah, having an undescended testicle really increases the risk. Family history can play a role too.
So what signs and symptoms should we be looking for?
The most common one is a painless lump or swelling in one of the testicles. Some men might also have pain or discomfort.
So any lump or swelling down there needs to be checked out.
Absolutely. Early detection is so important.
How is testicular cancer diagnosed?
We usually start with a physical exam and a scrotal ultrasound. If those suggest cancer, we might do blood tests for tumor markers or even a biopsy.
And what about treatment?
The most common treatment is surgery to remove the affected testicle. That's called an orchiectomy.
Can men still have children after that?
Usually, yes. One testicle is usually enough for normal testosterone production and fertility. But if a man is concerned about fertility, we can bank sperm before treatment.
That's good to know. Okay, let's move on to vasectomy, which is about preventing pregnancy, not treating a disease.
Right.
So what exactly is a vasectomy?
It's a surgical procedure that permanently prevents pregnancy. It involves cutting and sealing the vesticerans, which are the tubes that carry sperm from the testicles.
So basically blocking the sperm from getting out.
Exactly, and it's very effective.
But it's permanent, right?
It is. Vasectomy reversal is possible, but it's a much more complicated surgery, and it doesn't always work. So it's really important for men to understand that this is a permanent decision.
Okay, I know there are a lot of myths about vasectomy. Can you clear some of those up?
Sure, so vasectomy doesn't affect a man's hormones, his ability to ejaculate, or his ability to have erections or orgasms. It just prevents the sperm from being in the ejaculate.
So it's really just about contraception.
Exactly. But it's important to remember that some men might have some psychological adjustments after a vasectomy.
Like what?
Like they might feel anxious about it being permanent or have concerns about their masculinity. So providing emotional support is important.
Okay, let's talk about a sensitive but common issue. Erectile dysfunction.
Okay.
What is ED and what causes it?
Erectile dysfunction is when a man can't achieve or maintain an erection that's firm enough for sex. It's estimated that about half of all men between the ages of 40 and 70 will experience some degree of ED.
Wow, that's a lot of men.
It is. And while it's often associated with aging, it can actually affect men of all ages.
So what are the most common causes?
It's often a combination of factors, but the most common cause is vascular disease.
So problems with blood flow to the penis.
Exactly.
So it's not just a psychological issue.
Nope, definitely not. Psychological factors can contribute, but the underlying cause is usually physical.
Okay, what about treatment? What are the options?
The most common treatment is medication, specifically oral medications called phosphodiesterase type 5 inhibitors.
And how do those work?
They increase blood flow to the penis, which helps men get and maintain an erection.
Okay, so those are the little blue pills we see advertised. What about other options?
Yeah, those are the ones. If oral medications don't work or aren't appropriate, there are other options. There are vacuum erection devices, which use suction to draw blood into the penis. And there are intraurethral suppositories, which are tiny pellets inserted into the urethra that release medication to improve blood flow.
Those sound a little more hands-on.
They are. And for men who don't respond to those treatments, there are penile implants.
Which are?
There's surgically implanted devices that create an artificial erection.
So there are a lot of different options.
There are. But it's important to remember that ED can have a big impact on a man's self-esteem and relationships. So addressing the psychological and emotional aspects is just as important as treating the physical problem.
That makes sense. Okay, now let's talk about hypogonadism, which is often linked to aging.
Sure.
What is hypogonadism and what causes it?
Hypogonadism is when the body doesn't make enough testosterone.
Testosterone.
Yeah, it's the main male sex hormone. It can happen at any age, but it's more common in older men.
So as men get older, they just make less testosterone.
Exactly. And as testosterone levels go down, men can start to experience a lot of different symptoms.
Like,
Fatigue, decreased libido, erectile dysfunction, even mood changes.
wow, that's a lot.
It is. It can really affect their quality of life.
Yeah.
But the good news is that we can often treat hypogonadism with testosterone replacement therapy.
Oh, that's good to know. What does that involve?
It involves giving the patient testosterone, usually through injections, gels, or patches.
Okay, so it can help alleviate the symptoms. Okay, last topic for this part. Infertility.
Okay.
What is male infertility and how common is it?
Male infertility is defined as the inability to get a woman pregnant after a year of having regular unprotected sex. It affects about 10% of couples trying to conceive.
So it's not that uncommon.
No, it's not.
What are some of the common causes?
There are a lot of different causes, actually. It could be problems with sperm production, blockages in the reproductive tract that prevent sperm from being ejaculated, or lifestyle factors like smoking and drinking too much alcohol.
So it sounds like you really have to investigate to find the cause.
Yeah, it can be like detective work sometimes. The first step is usually a semen analysis, which checks the quantity, quality, and movement of the sperm.
Okay, and if the semen analysis shows a problem, what then?
Then we might do other tests, like hormone level checks and imaging studies to pinpoint the cause.
And what about treatment? Are there ways to treat male infertility?
Yes, there are. The treatment depends on the cause, but it might involve lifestyle changes, medications to improve sperm production, or surgery to correct blockages. And for couples who haven't had success with other treatments, there's in vitro fertilization or IVF.
IVF?
Yep, that's where eggs are fertilized with sperm in a lab and then implanted in the woman's uterus.
Oh, wow. So there's a lot of hope for couples struggling with infertility.
Absolutely.
Okay, so we've covered a lot of ground, from BPH to prostate cancer to infertility. It's clear that these conditions can have a huge impact on a man's life, both physically and emotionally.
For sure.
And nurses play a crucial role in providing care and support for these patients.
Absolutely. We need to be knowledgeable, compassionate, and sensitive to their needs.
Okay, before we wrap up this part, let's bring in a special expert to help us understand one of the more complex treatments. Hormone therapy for prostate cancer.
Sounds good.
Let's welcome our hormone therapy expert.
Thanks for having me.
All right, let's dive right in. So when we're talking about hormone therapy for prostate cancer, we're essentially trying to starve those cancer cells of testosterone. Can you explain how that works?
Sure. Prostate cancer cells need testosterone to grow and thrive, so hormone therapy aims to either lower testosterone levels in the body or prevent testosterone from reaching the cancer cells.
So you're basically cutting off their food supply.
Yeah, that's a good way to put it. There are a few different types of hormone therapy. One approach is to use medications called gonadotropin-releasing hormone agonists, or GnRH agonists for short.
GnRH agonists, those sound pretty complicated.
They are.
Can you explain them in a way that nursing students can understand?
Okay, so think of GnRH agonists like master manipulators of the endocrine system. They trick the pituitary gland into stopping the production of luteinizing hormone, or LH. LH is what tells the testicles to make testosterone.
So it's a chain reaction.
Exactly. By suppressing LH, we lower testosterone levels, which can slow down or stop the growth of prostate cancer cells.
That makes sense. What are some examples of GnRH agonists?
Some common ones are leuprolide, goserelin, and triptorelin.
Okay, so those are the master manipulators. Are there other ways to block testosterone?
Yeah, there are medications that block the action of androgens.
Androgens.
Those are male hormones, like testosterone. So instead of stopping testosterone production, these medications prevent testosterone from binding to the cancer cells.
So it's like blocking the key from fitting into the lock.
Exactly. These medications are called anti-androgens.
What are some examples of those?
Some common anti-androgens are bicalutamide, flutamide, and nilutamide.
Okay, so we can either suppress testosterone production or block its action.
That's right. The choice of which hormone therapy to use depends on a few things, like the stage of the cancer, the patient's overall health, and the potential side effects.
What are some of the common side effects of hormone therapy?
Some common ones are hot flashes, fatigue, erectile dysfunction, and decreased bone density.
So it's not without its downsides.
It's not. But for many men with prostate cancer, the benefits of hormone therapy outweigh the risks.
Okay, that's a lot of information, but I think we've got a good grasp on hormone therapy now.
Great. Remember, as nurses, you'll play an important role in educating patients about hormone therapy, watching for side effects, and supporting them throughout their treatment.
Absolutely. Thanks for explaining all that.
You're welcome.
All right, listeners, that's a wrap for part 1 of our deep dive into male reproductive health. We've covered a lot: BPH, prostate cancer, prostatitis, and even hormone therapy.
It's a lot to take in.
It is. We've got more to explore in part 2, so stay tuned.
Looking forward to it.
Welcome back to our deep dive into male reproductive health. In part 1, we tackled BPH, prostate cancer, prostatitis, and even got into the details of hormone therapy with our expert.
Yeah, we covered a lot of ground.
We did. Now let's shift gears and focus on some conditions that affect the scrotum and testicles.
Sounds good.
Okay, first up, epididymitis. Just to refresh everyone's memory, what exactly is epididymitis?
So epididymitis is an inflammation of the epididymis, that coiled tube on the back of the testicle.
Right, the one that stores and transports sperm.
Exactly.
What are the most common causes of this inflammation?
Usually it's an infection. It could be sexually transmitted, or it could travel up from the urinary tract.
So bacteria like chlamydia, gonorrhea, or even E. coli.
Exactly.
Okay, so if it's bacterial, antibiotics are the go-to treatment.
Absolutely. We want to knock that infection out as quickly as possible.
And if it's sexually transmitted, both partners need to be treated.
Right, to prevent reinfection. We don't want that infection bouncing back and forth between partners.
Makes sense. So while those antibiotics are working,
Mhm.
what can we do for the pain? Because I imagine epididymitis can be pretty painful.
Oh, yeah, it can be very painful. So we try to make the patient as comfortable as possible while we fight the infection.
Okay, so what do you recommend?
We usually suggest things like scrotal elevation, using ice packs, and taking pain relievers.
Okay, so just trying to soothe those testicles.
Exactly. Now, sometimes epididymitis can happen along with orchitis.
Orchitis, remind me what that is again?
Orchitis is when the testicle itself is inflamed.
So it's double the inflammation, basically.
Pretty much, yeah. The causes are similar to epididymitis, things like infections or trauma.
And the treatment's the same too.
Yeah, usually antibiotics, pain medication, and rest.
Okay, now let's move on to a couple of conditions that involve fluid buildup.
Yeah.
Hydrocele and spermatocele.
Okay.
Let's start with hydrocele. What causes that?
A hydrocele is basically a collection of fluid that builds up around a testicle. It causes swelling in the scrotum. Usually it happens because of an imbalance in the production and absorption of fluid that naturally surrounds the testicle.
So it's a fluid imbalance. Is it always there from birth, or can it develop later?
It can be present at birth, but it can also develop later in life. Sometimes it's related to inflammation or injury.
So do you always have to treat a hydrocele?
Not necessarily. If it's small and not causing any problems, we might just keep an eye on it. But if it's large, uncomfortable, or if the patient is bothered by how it looks, then we might drain the fluid surgically.
Okay, that makes sense. Now on to spermatocele. What's the difference between that and a hydrocele?
A spermatocele is also a fluid-filled cyst, but it forms in the epididymis. And the fluid inside a spermatocele actually contains sperm.
Interesting. So how do you treat a spermatocele?
It depends. If it's not causing any problems, we might just monitor it. But if it's large or uncomfortable, then we can remove it surgically.
Okay, got it. Now let's talk about a condition that can affect fertility. Varicocele.
Okay.
What is a varicocele, and how does it impact a man's ability to have children?
A varicocele is kind of like a varicose vein, but it's in the scrotum. It affects the veins that are responsible for draining blood from the testicles.
So how does that affect fertility?
Well, we think that the increased blood flow and heat from the varicocele can actually damage the sperm.
Oh, so that could lead to...
Lower sperm count and decreased motility, which means the sperm aren't swimming as well as they should.
I see. So if a varicocele is causing problems, what can be done about it?
There are a couple of options. We can do surgery to tie off the affected veins, or we can do a procedure called sclerotherapy.
Sclerotherapy.
Yeah, it's less invasive than surgery. It involves injecting a solution into the vein to block it off, which forces the blood to flow through other, healthier veins.
Okay, so a couple of different approaches depending on the situation.
Exactly.
Now let's switch gears and talk about a couple of conditions that need attention right away.
Okay, the urgent one.
Yeah, the urgent ones. First up, testicular torsion. What is it, and why is it considered an emergency?
Testicular torsion happens when the spermatic cord, which is what carries blood to the testicle, gets twisted.
So it cuts off the blood supply.
Exactly. And that's a big problem because the testicle needs that blood flow to survive. If we don't fix it quickly, the testicle could be permanently damaged.
Wow, so time is really of the essence. What are the signs and symptoms of testicular torsion?
The most obvious sign is sudden, severe pain in the scrotum.
I can't even imagine.
It's excruciating, and it can also cause swelling, nausea, and vomiting.
So if a patient comes in with these symptoms, what's the first thing you do?
We have to act fast. We'll do a physical exam and probably an ultrasound to confirm the diagnosis. And then we need to get them into surgery right away to untwist the cord and restore blood flow.
Wow, so every minute counts.
Absolutely.
Okay, nursing students, pay attention. This is one of those situations where you have to be on top of your game. You need to recognize the symptoms right away and make sure that patient gets the care they need immediately.
Couldn't agree more.
Okay, now for another condition that needs our attention. Testicular cancer. We talked about it briefly before. And mentioned it's the most common cancer in young men.
Yeah, that's right. It usually starts in the germ cells, which are the cells in the testicles that make sperm.
Are there any risk factors for testicular cancer?
Yes, a few. Having an undescended testicle is a big one. It means the testicle didn't drop down into the scrotum like it should have, and family history can also increase the risk.
So if a man has a family history of testicular cancer, he should be extra vigilant.
Absolutely.
What are the signs and symptoms of testicular cancer? What should men be on the lookout for?
The most common sign is a painless lump or swelling in one of the testicles. Some men might also have pain or discomfort.
So any change in the testicles should be checked out by a doctor.
Yes, absolutely. Early detection is key with this one.
How is testicular cancer diagnosed?
We usually start with a physical exam and a scrotal ultrasound. If those tests suggest cancer, then we might order blood tests for tumor markers. And in some cases, we might need to do a biopsy to confirm the diagnosis.
And what about treatment? What are the options?
The main treatment for testicular cancer is surgery to remove the affected testicle. That's called an orchiectomy.
Okay, so the whole testicle is removed. Can men still have children after that?
In most cases, yes. One testicle is usually enough for normal testosterone production and fertility. But if a man is worried about his fertility, we can bank his sperm before treatment.
That's reassuring to know. Okay, let's move on to vasectomy, which isn't about treating a disease, but about preventing pregnancy.
Right, it's a form of contraception.
So tell us, what exactly is a vasectomy?
A vasectomy is a surgical procedure that's done to permanently prevent pregnancy. It involves cutting and sealing the vas deferens, which are the tubes that carry sperm from the testicles.
So you're basically blocking the sperm highway.
That's a great way to put it, and it's a very effective way to prevent pregnancy. But it's important for men to understand that it's considered a permanent procedure.
Right, so not a decision to take lightly. I know there are a lot of myths and misconceptions about vasectomy. Can you debunk a few of those for us?
Sure, the vasectomy doesn't affect a man's hormone production. It doesn't affect his ability to ejaculate or his ability to have erections or orgasms. It just keeps the sperm from being in the ejaculate.
So it doesn't change anything about the sexual experience, it just prevents pregnancy.
That's right. However, it's important to note that some men might have some psychological adjustments to make after a vasectomy.
Like what kinds of adjustments?
Well, some men might be anxious about the permanence of the procedure, or they might have some concerns about their masculinity. It's important for us to address those concerns and provide support.
Okay, let's talk about a topic that can be a little sensitive, but is actually very common. Erectile dysfunction, or ED for short.
Okay, ED.
What exactly is erectile dysfunction, and what are some of the common causes?
Erectile dysfunction is defined as the inability to get or keep an erection that's firm enough for sex. And it's estimated that about 50% of men between the ages of 40 and 70 experience some degree of ED.
Wow, that's a lot of men.
It is, and while it's often associated with aging, it can actually affect men of all ages.
So what causes it?
It's usually a combination of factors, but the most common cause is vascular disease.
Meaning problems with blood flow to the penis. So it's not just all in their heads.
Nope, not at all. Psychological factors can definitely play a role, but the root cause is often physical.
Okay, so what can be done about it? What are the treatment options for ED?
Well, the first line of treatment usually involves medication. There are oral medications called phosphodiesterase type 5 inhibitors, or PDE5 inhibitors for short.
And how do those work?
PDE5 inhibitors, like Viagra, Cialis, and Levitra, work by increasing blood flow to the penis, which helps men get and keep an erection.
Okay, so those are the famous little blue pills we see advertised everywhere.
Those are the ones.
What if those medications don't work? Or if a patient can't take them for some reason? What are the other options?
There are a few other things we can try. There are vacuum erection devices, which work by using suction to draw blood into the penis. There are also intraurethral suppositories, which are small pellets that are inserted into the urethra. They release medication that helps improve blood flow.
Those sound a little more hands-on.
They are a bit more hands-on. And then for men who don't respond to those treatments, there are also penile implants.
Penile implants?
Yes, they are surgically implanted devices that help create an artificial erection.
Wow, so there's a whole spectrum of treatment options available.
There is. But it's important to remember that ED can really affect a man's self-esteem and his relationships. So addressing the psychological and emotional aspects is just as important as treating the physical problem.
Absolutely. Okay, let's talk about a condition that's often linked to aging. Hypogonadism.
Okay.
What is hypogonadism and what causes it?
Hypogonadism is a condition where the body doesn't produce enough testosterone. Testosterone is the main male sex hormone.
Okay, so it's a hormone deficiency.
Right. It can happen at any age, but it's more common as men get older.
So as men age, their bodies just naturally produce less testosterone.
Exactly. And as testosterone levels decline, men can start to experience a whole range of symptoms.
Like what kinds of symptoms?
Well, they might experience fatigue, decreased libido, erectile dysfunction, and even mood changes.
Wow, so it can affect their energy levels, their sex drive, and even their emotional well-being.
That's right. It can really impact a man's quality of life.
So what can be done about it? Is there a treatment for hypogonadism?
Yes, there is. We can often treat it effectively with testosterone replacement therapy.
And how is that given?
Testosterone can be given in a few different ways, usually through injections, gels, or patches.
Okay, so it can really help alleviate those symptoms.
Exactly.
Okay, last topic for this part of our deep dive.
Yeah.
Infertility.
All right.
What is male infertility and how common is it?
Male infertility is defined as the inability to get a woman pregnant after 1 year of having regular, unprotected sex. And it affects about 10% of couples who are trying to conceive.
So it's not as uncommon as some people might think.
No, it's not uncommon at all.
What are some of the things that can cause male infertility?
There are many different causes. It can be anything from problems with sperm production to blockages in the reproductive tract that prevent the sperm from getting out. Lifestyle factors like smoking and drinking too much alcohol can also contribute.
So it sounds like diagnosing male infertility can be pretty complex.
It can be. It often takes some detective work to figure out the root cause. The first step is usually a semen analysis, which examines the quantity, quality, and movement of the sperm.
Okay, so the semen analysis helps you get a better picture of what's going on. What happens if the semen analysis shows a problem?
If it shows a problem, then we'll do other tests to try to pinpoint the exact cause. We might check hormone levels or do some imaging studies.
And what about treatment? What are the options for treating male infertility?
The treatment really depends on the underlying cause. Sometimes it might involve lifestyle changes. Other times it might require medication to improve sperm production. In some cases, surgery might be necessary to correct blockages. And then for couples who haven't had success with those methods, there's assisted reproductive technology like in vitro fertilization or IVF.
Oh, right, IVF.
Yep, that's where the egg is fertilized with sperm in a lab and then implanted into the woman's uterus.
Okay, so there are definitely options available for couples struggling with infertility.
Oh, absolutely.
Wow, we've covered a lot of ground in this part of our deep dive. We've talked about epididymitis, hydrocele, spermatocele, varicocele, testicular torsion, testicular cancer, vasectomy, erectile dysfunction, hypogonadism, and infertility.
That's a lot of conditions.
It is, but these are all conditions that nurses might encounter in their practice.
Exactly, and it's important to have a good understanding of these conditions and how to care for patients who are dealing with them.
Absolutely. We need to be knowledgeable, compassionate, and sensitive to our patients' needs. Now, before we wrap up this part, let's talk a little bit about the psychological impact of these conditions, because a lot of these issues can be very sensitive and personal for men.
Oh, absolutely. These conditions can really affect a man's sense of self-esteem and masculinity. They might feel embarrassed or ashamed to talk about it, even with their healthcare provider.
So how can we, as nurses, create a safe and comfortable environment for these patients to open up?
Well, the first thing is just to be aware of that potential for embarrassment and approach them with sensitivity and empathy. Let them know that you're there to listen without judgment and that you want to help them feel better.
So active listening and therapeutic communication are key.
Exactly. And we need to reassure them that they're not alone. These conditions are actually quite common.
Right, and there's no shame in seeking help.
Exactly. And sometimes it might be helpful to involve their partner in the conversation if they're comfortable with that.
Okay, so communication and support are crucial.
Absolutely.
Okay, listeners, that wraps up part 2 of our deep dive into male reproductive health. We've explored a wide range of conditions that can affect men, and we've highlighted the important role that nurses play in providing compassionate and knowledgeable care. Stay tuned for part 3, where we'll wrap up this deep dive with some broader nursing considerations and emerging trends in male reproductive health. All right, welcome back to our deep dive into male reproductive health. In parts 1 and 2, we covered a lot of different conditions, from BPH to prostate cancer to testicular torsion. And we talked about all sorts of treatments, medications, surgery, even assisted reproductive technologies.
It's a complex area.
It is. So in this last part, let's zoom out a bit and think about some broader nursing considerations that are important when you're caring for men with these sensitive health issues.
Okay, sounds good.
It's important to remember that these conditions can really affect a man's whole life, not just physically.
Yeah, absolutely. It can affect their emotions, their relationships, how they feel about themselves, their whole well-being, really.
So as nurses, we need to be sensitive to that, be empathetic, and really listen to our patients.
That's so important. And remember that these are often embarrassing issues for men to talk about.
Exactly. So we need to create a safe space for them, a place where they feel comfortable opening up and asking questions. No judgment.
Definitely.
Okay, let's talk about some specific nursing interventions that might be needed for these patients. What comes to mind?
Well, pain management is often a big one.
Yeah, especially for conditions like prostatitis, epididymitis, and after surgery.
Right. Pain can really slow down a patient's recovery, and it affects everything.
It does. So we have to be proactive about assessing their pain and managing it well, using both medications and non-pharmacological approaches.
And remember that everyone experiences pain differently.
Exactly. What works for one person might not work for another. We need to individualize our care. Another common problem is difficulty peeing, which can happen with BPH or as a side effect of treatment for prostate cancer.
Right. Things like trouble starting to pee, weak stream, having to go all the time.
Exactly. And that can be so frustrating for patients.
Oh, absolutely.
What could we do to help?
Well, sometimes we need to use a catheter or try bladder training or medications. But education is key.
Yeah, we need to teach them how to manage their condition at home, what to expect, and when to call for help. We want to give them the tools to feel in control.
Exactly.
Okay, we can't forget about the psychological impact of these conditions.
Right. Men often struggle with a lot of anxiety and fear around these issues, and some embarrassment, too.
Yeah, and those feelings are totally normal. We need to acknowledge them and be supportive.
Absolutely. Just listening to them, really hearing them, can make a big difference. And sometimes it helps to include their partner in the conversation if they're comfortable with that.
For sure. And don't be afraid to refer them to a mental health professional if they need more support.
Right. Counseling can be really helpful. Okay, so let's talk about some potential complications that can come up with these conditions, things we need to be watching for.
Okay, what are some red flags?
Well, for conditions like BPH and prostate cancer, we always worry about urinary retention.
Urinary retention.
It's when the bladder doesn't empty completely.
Oh, I see.
It can be pretty uncomfortable and lead to other problems.
Okay, so what do we need to do?
Monitor their urine output really closely. Check for any signs that their bladder isn't emptying. And if it is full, we might need to use a catheter to drain it. That helps relieve the pressure and prevent complications.
Got it. What else?
UTIs are also a concern, especially after procedures or surgery.
Urinary tract infections.
Yep, they can be pretty painful and usually need to be treated with antibiotics. And of course, with any surgery, we're always watching for signs of infection, bleeding, or other problems. Good wound care, monitoring their vital signs, and just being really observant are all important.
Okay, so those are things to watch out for in the hospital.
Right. And then we have to think about sexual dysfunction, which can happen as a side effect of some of these treatments.
Yeah, that can be really difficult for men to deal with.
It can. We need to be sensitive to that, talk about it openly and honestly, and offer them support and resources.
Exactly. Okay, so we've talked about the challenges. What about the future? Are there any exciting advancements in male reproductive health?
Oh, absolutely. Robotic surgery is becoming really popular for procedures like prostatectomy. It's less invasive and recovery is usually faster. And there's a lot of research happening on new medications for things like erectile dysfunction and prostate cancer. Plus, we're moving towards more personalized medicine where treatments are tailored to each patient's specific needs and even their genes.
Wow, that's amazing.
And there's a growing focus on men's mental health, too, recognizing that these conditions can have a big impact on their emotional well-being.
That's so important. We need to encourage men to talk about their mental health and get help if they need it.
Absolutely.
Okay, before we wrap up this deep dive, let's recap some key takeaways for our listeners.
Sounds good.
What are some of the most important things you want them to remember?
Well, I think the biggest thing is to remember that we need to care for the whole person, not just their physical health, but also their emotional and social well-being.
So taking a holistic approach.
Exactly. And we need to empower our patients, encourage them to ask questions, share their concerns, and be involved in their care.
That's so important. What else?
Early detection is key. Regular checkups, self-exams, and appropriate screenings can make a huge difference in catching problems early and improving outcomes.
Couldn't agree more. Anything else?
Yeah, I just want to emphasize that there's hope. There's help available for anyone struggling with these conditions. No one has to suffer in silence. There are treatments, resources, and support systems out there.
That's a great message to end on. Okay, listeners, that concludes our deep dive into male reproductive health. We've explored a lot of complex issues, talked about the latest treatments, and emphasized the essential role nurses play in providing compassionate and skilled care. We hope this deep dive has given you a solid foundation of knowledge about these conditions and inspired you to learn even more. Because remember, this is just the beginning of your journey as nurses. You'll continue to learn and grow throughout your careers. Keep learning, stay curious, and always advocate for your patients. Thanks for joining us.